Text appears on screen, developing and measuring the success of a comprehensive prevention framework.
Welcome back. Thank you for joining our session on developing and measuring the success of a comprehensive prevention framework. As a reminder, if you need assistance today, the help desk is available. Please note that the resources for today's sessions are available to download in the handouts window. My name is Amanda Cruz, and I'm really excited to have you here. I am a foster and adoptive parent and a consultant for the Capacity Building Center for States. I have 6 adopted children, and we have fostered over 50 and helped reunify most of them. You may wonder why a foster parent is involved in this session as your host and doing the introductions. And I want to just really think about how it is time to really work with our resources and reallocate them in a way that works for a new system and a new way of doing child welfare. The need to use our volunteers, our community builders, our community organizers. And that's really what foster parents are, people coming to the table to make change and really having only one avenue. This is the time to get them involved, to get them excited. The vast majority of foster parents want children to stay at home and would be happy to help themselves out of a position of a volunteer role. In my community, I proudly partner with our resource centers and communities to make sure that families have what they need before foster care is even considered. I'm excited to introduce you to this wonderful session. We're going to be hearing from individuals separately and then come back together for a panel discussion. While the programs and messages may vary, the underlying call is the same. That we have got to have systems change now so that community-focused prevention efforts that have quality principles and are implemented with fidelity start coming out of all areas of the country. All of this while we're making sure that consumers of the system are at the table and involved at every level. This is no small feat. We have to make sure that prevention is not done alone and that it is not just a word that we use for helping families right before they enter care. It has to be combined with clear measures and principles of continuous quality improvement. We have to have feedback loops where people are involved at all levels. You don't have to be a data person inherently to understand CQI, although it does help. It can't be done in a vacuum, and it has to be something that we are all able to enjoy, participate in, and communicate about. Feedback loops that clearly include family and youth voice are a vital part of making this large systemic change. It is of vast importance that family and youth voice is involved in all areas of prevention services, planning, and CQI. There are lots of challenges. I'm not going to lie to you. This is going to take a lot of work. It is hard and it is messy. Not each meeting or engagement is going to go well, but we know that already. That's true when we have professionals at the table, groups with master's degrees and PhDs and judges. But often when we invite families to join us, we have an even higher expectation. If it isn't perfect the first time, do we go back and try again? Do we figure out what we did wrong? The challenge is that at the systems level, we have not made room at the table. It is time to make room at the table to move forward. There is such an imbalance of power and so much tied into racial inequality that having those initial difficult conversations about family engagement, who is there and what is ignored, cannot be left out when we're talking about prevention, community work, and family engagement. There are strategies that have already been developed and worked through and available in each area. The Children's Bureau issued IM 1903 that really explores how vital it is that we include family and youth voice at all levels of service. How do we best implement prevention programs in a neighborhood? We have to ask the people that live there. How do we make sure case managers are compassionate, offering appropriate services and making the right impact? We have to ask the families that they're helping. And how do we make sure that at a high level, we are creating the policies that help reach the goal of safe reunification, reduce the need for removals, and help decrease the need and reliance on child welfare? We have to have family and youth at the table all the time, every time, from the very beginning. Even when you don't understand why families should be there, their insight may be the start of the newest prevention method and maybe the next big program that helps change where we're going. This is a really exciting time in child welfare. I don't know about all of you, but the last 6 months have been a little stressful. We have seen more immediate change due to the pandemic across all levels of child welfare at the federal, state, and local level than we have ever seen this quickly before. This energy is something that we can create for positive change and use it to work towards different prevention efforts. It is a time of hope. There are resources and effort and time being put towards prevention services. Programs, mindsets, and cultures are shifting in pockets across the country. There isn't a roadmap yet for the perfect prevention program, but there is the need for a clear, in-depth program everywhere. Federal support is widespread, and there is acceptance that children do better with their families, in their home, with no removal. Now is the time to make that happen. There is a very clear call to action to work with family and youth to help children stay home and stay heard whenever safe. The panel we have for you today are going to highlight some of the amazing work that's being done around the country. First, I'm very pleased to introduce you our first speaker, Dr. Amelia Frank Meyer. She's the founder and CEO of the national nonprofit ALEA, which is building a proof of concept that public child welfare agencies can serve as primary prevention agencies with a newly redesigned purpose of keeping children safe with, not from their families. Amelia was named as one of People magazine's 25 Women Changing the World in 2018. She has a TED Talk on the human need for belonging, viewed more than 50,000 times. Welcome, Amelia. I'm really excited that you're here today.
Text appears on screen. Prevention Frameworks, Reimagining Child Welfare.
I want to talk to you today about what happened in 2017 when ALEA called together 100 innovators from around the country to design a better way of work in child welfare. At the end of 4 days of work in human-centered design, they developed 30 different prototypes, which we call together Anan System. The new way of work doesn't yet have a name. Some call it the Family Strengthening System, some the Family Wellbeing System, but all we know is our new way of work is not this way of work, and so we call it Anan System. A year later in 2018, ALEA asked for jurisdictions who wanted to try these new ways of work on the ground in their jurisdiction to join us in an innovation cohort. 10 systems applied, and we tried to talk all of them out of it, but 5 remained committed to building a primary prevention system in their work in the Child Welfare Agency. Those 5 jurisdictions, representing 14 counties in 4 states across the U.S., have been working since 2018 to build new ways of work in prevention. At the end of their first year, the collective results were a reduction of 12% in foster care placements and a reduction of 37% in residential placements. We worked together to build a proof of concept that a public child welfare agency can become a primary prevention agency, which is easier than it sounds, and even harder to measure. And so what we learned in measuring all of the indicators of prevention across jurisdictions was that there is not a standard way to measure many of the variables in which we were interested. Measuring reliably across systems, there were different definitions, different ways of gathering information, and much of what we wanted to know wasn't measured at all and instead had to be counted by hand or relying on the memory of some of the leaders involved in that system. Additionally, once we were able to reduce the numbers in care, we became very interested in the question of, are the children safe even though they're not being removed from the home? We had long discussions about risk and safety, the difference between them, and how to measure them. We talked with other professionals, such as reliability engineers in the medical device industry, engineers in radioactive technology about radiation exposure, safety, and risk, and tried to bring in other ways of thinking into child welfare because we have not yet tackled how to measure whether or not children are safer or safe in consistent ways across systems. What we learned is that we don't have good data in our field yet, particularly for the kinds of things we're trying to do in a new way of work. We wanted to know things like how many children are harmed in a particular jurisdiction in out-of-home care, and what about that compared to residential settings, and who holds that data? And what we learned is sometimes it's held by a system serving folks with disabilities, sometimes in the juvenile justice system, sometimes at the local level, and sometimes by the state, and sometimes not at all. There was not an easy, consistent way to answer really important questions, which are children safer at home despite reports of abuse and neglect if we leave them home? Are the rates of harm greater or lesser for children who come into care in foster care or in residential? What is the rate of harm in residential centers? What is the general rate of harm for children in the community? And what we mostly learned was we have a long way to go when we talk about measuring risk and safety in our field. Measuring innovation in systems is very challenging because as you move parts of a system, other parts also move. And so we don't really know where exactly to look for measures. It's not clear what change to expect or where change might occur. In prevention efforts, many of the changes happen at the individual, at the family, and at the community level. And so as we work to keep families more safely together, the indicators might show up in places like reduce absenteeism at school, or may show up in economic or employment indicators that are handled by a completely different system. Nevertheless, we must measure something. So the right answer we determined was measure what you can. Look at the data which is already being collected and start to find clues from there. And so that's what we did. We let the data tell the story and then knew what next questions to ask. In my humble opinion, we are not currently measuring the things that matter most, like community conditions necessary for children and families to thrive, or child and family well-being, or levels of risk necessary in various settings. And we really don't have good ways to measure. So once we're clearer on what families need to be able to safely parent, my hope is that we'll begin to measure that, measuring the social determinants of family well-being rather than the number of placements, the length of stay, or other measures that we currently measure, which by and large reflect removal and separation and out-of-home care. So as we learn more about what prevention takes, we'll also learn more about how to measure those elements of family well-being, community conditions that parents need to safely parent, and other indicators that show we're advancing our goals in prevention. Next, we're going to hear from Sheriff Dean Ibrahim and Marina Haven from the District of Columbia's Child and Family Service Agency, DC's federal Family First Title 4E program and 5-year plan, putting families first in DC. It has been in operation since October 2019. Sheriff Dean is the program manager in the Community Partnerships Administration, and Marina is the Chief Information Officer, and they're going to be talking about DC's prevention framework, partnerships and information system, design considerations that support a prevention-focused system.
Text appears on screen. Prevention frameworks, collaborating to achieve and measure success.
Thank you, Amelia, for the introduction. My name is Sheriff Dean Ibrahim. I'm here to talk about our initiatives in Washington, D.C., Putting Families First and Families First DC. Putting Families First is our federal Family Service Prevention Services Act, and Families First DC is our local initiative. At CFSA, we subscribe to 4 pillars. We subscribe to Front Door, which is keeping families together with their natural supports. Temporary Safe Haven, which is also identifying foster care homes for families. Well-being, creating an environment where children can thrive and foster healthy relationships. And also exit to permanency. So CFSA, we believe that we are not the child welfare system, we're the child welfare agency. And that means we collaborate and partner with community organizations and sister agencies, in addition to our work that we do within our organization and our operations. Families First DC is a local initiative that was launched by our mayor, and we utilize data to identify hotspots in the city to address social determinants of health issues, prevent crime and prevention data, and also child maltreatment data. We currently have 10 success centers, family success centers, 5 in Ward 7 and 5 in Ward 8.
A map shows the DC Families First neighborhoods and the locations of schools, rec centers, libraries, ONSC offices, and American Job Centers. Neighborhoods were chosen based on social determinants of health data, violence prevention priority areas, and substantiated reports of child abuse and neglect.
Also, our Putting Families First initiative, we focus more on evidence-based prevention services and programs. We utilize extensive CQI processes and systems to correct our work. We address our target population's needs being met and addressed. We averting child abuse and neglect. We utilize case management in terms of motivation interviewing to combat and to really serve as the central focus of how we engage and build relationships with families that we work with across our continuum.
Text appears on screen. CFCA's CQI process includes evaluation strategy, fidelity and improving outcomes, assessing capacity needs, and refinements, program implementation. Partnerships involve MOUs, MOAs, consultants, information and technology, and committees.
What we currently are doing in Washington, D.C., we recognize that there's a partnership that requires all systems playing an intricate role. We have reached out to our information system that have helped to build different platforms in which information can be captured and data can be recorded. We also have identified subgroups and working groups to also collaborate and work through issues and problem solve areas where we know that we are not meeting our goals and our targets. In addition, we intentionally planned for a planning period before implementing our success centers to allow our partners who are operating family success centers to have adequate time to roll out a model that is sustainable. Please allow me to introduce our Chief Information Officer, Marina Havan, who will now speak to our infrastructure and our IT systems and business processes that we've implemented to help launch the sustainability of our Putting Families First initiative and Families First DC plans.
Okay. Thank you, Chair Dean. As mentioned, our Director Brenda Donald has been a preventive services advocate for a long time. We have multiple programs that she has really advocated for us to implement, both on the program side and on the technology side. So when we had the opportunity to implement Family First on October 1st, on 2019, she was very adamant about us meeting that deadline. As a result, we had to start building the IT infrastructure to support our Family First plan while it was being negotiated with the Children's Bureau, essentially building an airplane in flight. To meet the deadline, we had to meet 3 challenges. First was flexibility for changes in the system, because we knew things were going to change as we were building the system. Second was our long-term plan to implement a comprehensive child welfare information system. We have currently a legacy system, what we call FACES, but it's been in place for over 20 years, and it's time for it to change. And third was meeting the ACF requirements for comprehensive child welfare information system technologies, and just meeting those specific design and technology criteria. The result was working with our program staff and our community-based providers of services, preventive services, to essentially bucket our requirements in two areas. The functional requirements that had to be part of a social worker's daily operation and just be in the flow of the process were all put in one bucket. And things that were brand new and were really had new players and new data elements were then put in a second bucket. For the first group, we made our changes in our legacy system because we wanted to minimize the need for social workers to disrupt their workflow while they were doing case management and completing steps and visit notes, and we wanted them just easily flow into ordering services for our families. The second bucket, we decided to use modern technology and and utilize Amazon Web Services, AWS tools. And this was a way for us to increase the shelf life for what we were building, essentially building something outside of the legacy system. Additionally, we built a application program interfaces that act essentially as air traffic controllers, putting data in the right places between our new system and our legacy system. Our new technology stack, we call the CFSA Community Portal, that has been really designed with the community partners and other agencies that we order services from. The CFSA Community Portal was built with about over 30 microservices. And what microservices does in an application is it breaks the application into small components, and that allows us flexibility in if we need to change something, we can change that piece out and insert another piece, or just add additional microservices on top to meet the flexibility that's needed. Because as I said, we were building a system while the program was being developed, and also we knew that as other states come in and the federal program matures, our practice will evolve too. And that's where really those are the decisions we made, and have served us well as we find things that our partners in the community wants to add, and also our social workers, as we look at the CQI data to see where can we have more uptake, where can we have more information in. We've posted our documents and our source code on the ACF collaboration platform, available for all agents, other states to utilize, and we're happy to share our information with other agencies and gain experience from them. So with that, I'm gonna hand over the discussion to our colleagues in Michigan. Kelly Wagner and Lynn Bullard have worked in the state of Michigan. Kelly is the Director of Child Welfare Services at the Michigan State Court Administrative Office and oversees the state's court improvement program and foster care review board programs. Lynn Bullard serves as the friend of the court family division administrator for Van Buren County Courts and oversees the Van Buren County Quality Legal Representation Pilot. Thank you.
Text appears on screen. Prevention Framework, Legal Perspectives. Kelly Wagner.
Thank you, Marina and Sheriff Dean. In Michigan, we are developing a prevention pilot that includes the legal and judicial communities. And when we look at prevention, we look at it in both of terms of preventing children from being removed from home when they're safely able to do so, and also preventing prolonged family separation when children do have to be removed from home. And we identified this as a strategy following our 2018 Child and Family Services Review. And at that time, the Children's Bureau invited Michigan to try out a new format for the developing of the Program Improvement Plan, which is the document that will describe how the state plans to improve its CFSR outcomes going forward. And the idea was to compel joint planning. Normally, the department, at least in Michigan, did all of the hard work when it came to the PIP. They dove into the CFSR data outcomes, they identified the root causes and barriers, they identified and developed solutions, and then they would run that by the stakeholders. But the Children's Bureau had a brilliant idea to bring everybody together for this work. And that included not only a very wide variety of professional stakeholders who work in the system, so the courts, tribes, private agencies, etc., but also really importantly, and as Amanda mentioned, people who had experience with either the foster care system or child protective services. So the meeting included parents, foster parents, youth, CASAs, etc. And so we did this in January 2019. The Capacity Building Center for Courts, under the leadership of Jennifer Rennie, facilitated a 4-day-long meeting with this broad array of stakeholders, and it was fantastic. Continuously throughout that 4-day meeting, it was the people with system experience, and in particular the parents and youth, that continuously raised legal representation as an issue, as a root cause, as a systemic issue, and really over those 4 days, it became so clear to us how impactful legal representation can be on outcomes, and in particular for the better. And so taking all of that information in, the CIP, the Court Improvement Program, worked with the department to develop a general structure for a high-quality legal representation pilot. And we included that pilot in the state's CFSR Program Improvement Plan as one of 4 projects to improve our state's outcomes, which to me really signifies the importance of this issue. And so when we, in selecting the counties, it was of course really important to look at the CFSR outcomes in those counties, time to permanency, entry and exit rates, etc. But also equally importantly, if not more so, we looked at leadership at the court and leadership at the county department, because we asked them to develop their own unique pilot projects based on the best practices and some information that we provided them, but they are doing all of the hard work in developing their quality legal representation pilots to meet their county's needs. And I am very pleased to introduce to you my colleague, Lynn Bullard, who is one of those leaders that we chose. Lynn is the family administrator and the friend of the court in Van Buren County, Michigan, which is in Southwest Michigan. And Lynn can talk about the pilot that they're developing. Welcome, Lynn.
Thank you, Kelly. Our court is just very excited about the opportunity that this pilot provided to us to look at ways that we could strengthen legal services for parents and for children in child protective cases. And the goal of our pilot is to improve outcomes for children by either avoiding removal or reaching permanency as soon as it is safe to do so. Our pilot focuses on 3 major areas. Those areas are changes in our court-appointed attorney contracts, adding a social worker to the parents' legal team, and providing ancillary legal services that remove barriers to permanency. So when we looked at our attorney contracts, we made 3 fairly major changes. First of all, we changed the way that we compensate our attorneys. And we moved from a flat monthly rate that we paid all of the attorneys on our roster to an hourly rate. And attorneys are compensated for all the work they do on cases, both in and out of court, on this hourly rate. We also now require all of our court-appointed attorneys to complete a minimum number of hours of training every year. And last, in addition to complying with Michigan court rules and Michigan statutes for legal representation, all of our attorneys also now must comply with the American Bar Association model standards for parent and child legal representation. When we added a social worker to the parents' legal team, we thought that this would just be a great way to bolster that advocacy for the parents. And the social worker can be added or assigned to a case either pre-petition or post-petition. And their role is really to establish a rapport with the parents, to help the parents problem solve, and to advocate for the parents. So an example of some of the advocacy that a social worker can do in a case, for example, they can help identify maybe a legal need that the parent has, and they can explain that process to the parent, and they can make a referral for an attorney to be appointed to represent a parent to remove some kind of barrier. They could also help the parent problem solve. So an area where this might occur is parent-child visitation. We have very few resources for parents to visit with their children when they've been removed from the home. That's usually due to a lack of supervisors. So the social worker may work with the parent and come up with a list of appropriate supervisors. The third area where we made changes in our program were to provide ancillary legal services to parents. These services can be provided both pre-petition and post-petition. The attorneys that are assigned to these cases are compensated at that hourly rate. And some of the examples of some ancillary legal services that our court or these attorneys are providing are things such as applying for disability benefits for the benefit of a parent or a child, obtaining personal protection orders, maybe helping a parent get a driver's license restored, or filing for a divorce or a custody action. Next, we're going to join Amanda Cruz, who will facilitate a discussion with all presenters.
Text appears on screen. Prevention frameworks, panel discussion.
Thank you all. That was an amazing overview of programs from the top down and showed such a wide range of ways that prevention programs are working, are locally created, regionally implemented, and can have a foundation in the important principles of family at the heart of their own story. We have some questions, and I'm really excited to chat with each of you a little bit more and talk about your programs at their core. I want to really start with talking about Family and Youth Voice. How has engagement with those with lived experience enhanced planning, development, and monitoring of the programs? And how will they really continue to be engaged as performance and change is considered and approved upon? Kelly, I know you talked about that a little bit, but I wanted to know if you could dive in just a little bit more.
Absolutely. Yes, for the Quality Legal Representation Project, that voice was very important. And that's because in Michigan, we don't have any kind of a state level system or oversight or data reports that we love to dive into regarding legal representation. We have 83 counties in Michigan, 57 circuit courts, each with their own attorney contracts and requirements and vastly different compensation structures. And so it's difficult or not intuitive, at least to me, to think of legal representation as a systemic issue that we could influence. So without that voice at that 4-day meeting where we were developing the PIP, I'm not sure if it would have been included or identified as a systemic issue in Michigan that we should focus on. And so the stories they shared, especially the positive stories that they shared about legal representation truly helping families improve outcomes, is really why we have this pilot project. And I thank them all for being so open and honest about it.
Thank you so much. And I'm glad that you gave them the space and that they were able to do that. Thank you. Sheriff Dean, what does that look like in Washington, D.C.? Can you tell us a little bit more?
Sure. Thank you, Amanda. So here in Washington, D.C., our two initiatives, Putting Families First and Families First DC, really was a process to really bring together, once again, the system being the community, sister agencies, advocates, providers, all key essential figures and players. So when we look at our prevention programs and services, we really have all the right people at the table, giving us feedback, giving us firsthand account of how to make sure our practice and our systems are very streamlined and very linear in terms of how to reach and meet the needs of the community and the families and the population that these prevention services can benefit. With our Families First DC model, it is 100% community voice, community driven, community led. As I stated earlier, our director was very deliberate in ensuring that there was a planning period to have all success centers up to speed as it relates to actually getting feedback and doing some needs assessment and doing some community forums, and also really taking that information to drive what each success center will look like and what programs and what services will operate out of those success centers, because it's really for the community, it's for the residents. So building on protective factors, mitigating trauma, those types of things are really critical as we use this planning period, these first 9 months, and prepare for the implementation and the launch in the fall. So all of our work, all of our efforts have been really bringing together committees, groups, advocates, experts who really are in the field, who are doing the work, and kind of creating like a learning community to better roll out what we intend to do, which is provide effective programming and services for families and residents of our district.
Thank you so much. I think one thing that I would be remiss if I didn't say is I think it is so amazing to me, the words that you choose and that I think your district chooses that help not just make families feel successful, but make programs feel successful. Calling success centers, every time you say it, I just get so excited. Like that just makes you think, what a great idea. But even learning communities, I think when we have family and community in the room, we don't often think, what am I going to learn from this experience? And I just love the way that you guys have framed that. So thank you. Thank you for that. Amelia, I wanted to turn over to you and ask the same question, how working with family lived experience has really changed development and monitoring of the program you're working on.
Sure, thanks. So in the Anan System innovation cohort, each one of the jurisdictions involved is assigned a lived experience guide and a professional guide. So a lived experience guide would be someone who spent time in care or who lost children to care. And they're really there as a guide to the leader to say, that might not have worked for me and my family, or might you consider this voice, or maybe you should talk to these other folks about that, or I've heard more about another way to do that. And so they're really there to guide the leader in the system, keeping the voice front and center, lived experience voice front and center. So the guides participate in every meeting, in every conversation, in every piece of the design, and are present in that way. We also have added an alumni innovation fellow, someone who spent time in care growing up, onto our team for a year appointment, so that all that we're doing has really that perspective and voice on our all pieces of our work. It's really an important piece of the development of a prevention system is to work with families and youth to community co-design and family co-design new ways of work rather than using our best ideas and then seeing how they turn out. So we do have folks with lived experience on our board of directors, both parents and youth. And our evaluator is a person of color because we know that he will ask the right questions about what to measure in communities. And so really integrating not only voices of color, but also specifically lived experience voices at every level in the organization and in the process.
Thank you so much. I really appreciate that. I think we often have values and it's kind of easy to implement them at the ground level, right? But sometimes harder to recognize that that has to be throughout the whole system. And I really appreciate that that's how you guys are doing it. I think that's one of the incredible things about ALEA. My second question, I want to talk a little bit about the strategies to engage community partners, such as agencies, community organizations, police, moving on. Amelia, do you want to speak to that first?
Sure. I wish I had clear, simple, and easy answers here, but what I can tell you is that you have addressed the two most challenging things that we're working with in the cohort. So the first being really working with families and communities to co-design, as you mentioned, and then the second is to engage other community partners. There is a tension between really thinking about what kinds of change are you trying to make, getting the agency and the staff on board so that they can, consistently represent the change, understand and use the change in their work, and inviting and partnering with the community, and so which comes first, the chicken or the egg? And what I can say is that we're learning a lot of lessons about this, that the initial thought was if you can shift the mindset of the agency and of the team so they better understand authentic family engagement and partnering with folks with lived experience, that then we would bring the community together and begin to design that way of work. But instead, what has happened is that in starting in the agency first to make those mindset shifts, it seems that the agency sometime moved out a little further ahead than other community partners. And so it felt like a larger and larger disconnect was gaining. So one of our biggest commitments this year is really working with community-based organizations in different kinds of ways and with families themselves directly to design new ways of work. And so what I would say is that the mindset shift needed to design new ways of work has to really happen simultaneously in the agency and in the community. And that is an enormous lift for leadership to do or for communities to do. But what we're seeing is that they really have to happen in unison, that everyone has to come together at the same time at their levels of learnings. Otherwise, a lag develops, which then, creates kind of a it's your thing, not our thing, or an elitist sort of mentality of you think you know better, but we're doing just fine over here. And so, setting as many places at the table as possible will serve later on to move things more quickly, even though it's a really challenging ask in the beginning.
Thank you. Thank you so much. Marina, what strategies have you used up in DC for engaging community partners and different agencies, looking kind of from that system design perspective? How's that going, and what have you found successful and maybe not successful?
Great question. So we've had community-based organizations, what we call collaboratives, in the District of Columbia for over 10 years. So our relationship with the collaboratives as are essentially community-based organizations that have the same focus as we do in keeping families out of our the child welfare system has been long and very fruitful. So as we were building the Family First Prevention system, both the program side and the technology side, we worked very closely with our community partners. And by that, I mean meeting every 2 weeks and going over, does this make sense? Does that make sense? In addition, within CFSA, we have a group referred to as the peer group. And the peer group are former families that have had children removed, former foster children, and just full spectrum of our clients. And they are internal to us within the agency for multiple reasons. They support our social workers, they give feedback on the programs and on the new things that we develop. So we had the community partners help us do the design for our systems. They even were part of our user acceptance testing. So we included them in accepting the technology that they were going to be using. And I think where we succeeded a little bit, at least I feel, I hope we did, was that they, the things that they said and found during testing and or training that we did, we weren't able to put out immediately in October, but we came in within 2 months and implemented them. And so that, I feel, built more trust, and when they raise things, they know that we're gonna address them and we care about what they say. So I think, building that trust and that their voice is heard and there's action to it has been a good partnership for us.
That's fantastic. I agree, right? Only way to really build partnership is to show that you really want to listen and that you mean to implement those things. Thank you so much. Lynn, you had talked about the pilot program being in its early stages. How is a success going to be measured, and who's really involved in those conversations? What does that look like?
Okay, I'm happy to speak to that. Right now, we're in the process of talking about how we're going to measure our success. And so the team that is working on that includes myself, our social worker, a social worker consultant that has experience in interdisciplinary teams, and then also an evaluator. And we are talking about what data will help us measure how often our program results in removing barriers for parents, how often our program prevents removal from the home, and when children are removed, how quickly they are returned. So we're looking at those 3 areas right now and having discussions on what things can we track that will help us measure these things. So far, the things that we're looking at are a lot of things that we do to improve parent engagement. So our parents coming to hearings, our parents keeping their appointments with the social worker, are they following up with recommendations? So that's the beginning of our dig into data.
And I have a follow-up question that might not be a fair question, but I want to ask it anyway. Right now, when a lot of court hearings are telecourt, has that changed your engagement? Are you seeing anything different, or is it too soon to know?
Well, that's very interesting because what we have found, at least in our county, is that holding the hearings through technology has actually made it a lot easier for a lot of our parents to participate. Many of them have difficulty with transportation. Either they don't have a car, or they're relying on somebody else to get here, or the car breaks down. Childcare. If they've got young children in the home with them, it's difficult to find childcare for them to get to a hearing. And so I think the majority of them have picked up on the technology pretty quickly, And we're really finding across the board in our courts that this is probably a good thing that's come out of this pandemic situation, is that we've been able to find another way to get parents into the courtroom without them having to get in their car and get here.
Absolutely. Thank you. And I am just naturally one of those people that always look for where is a silver lining, or please let there be a silver lining. And that's one that we are seeing in Florida too, is just this increased engagement and maybe also lack of intimidation, right? If you're virtual, it's not quite as scary as standing in front of that judge and having those really hard conversations. Thank you, Lynn. Thank you for that. There's a lot of conversation just in general about evidence-based practices, which are validated by some form of documented scientific evidence, and evidence-informed practices, which use best available research and practice knowledge to guide program design and implementation. We've heard a lot about evidence-based programs and their use, as well as other promising strategies as an important aspect of improving outcomes. We obviously know that there are lots of benefits, challenges, and different strategies. And I wanted to turn it over to Amelia for a minute to kind of talk about that and dig a little deeper into this idea of evidence-based programs and strategies.
Sure, I'd be happy to talk about that. So, I think our field has, over the past decade, become really enamored with this idea of evidence-based practices. And although on the surface it sounds like, why would you not do things that have not been proven? Of course you would use evidence-based practices. However, to have a practice really elevated to the level of being in the evidence base, it requires such a strong adherence to fidelity that many times when that same practice is used in the field, on the ground, it's not possible to continue to do the practice with that same level of fidelity. And that has to do with a whole bunch of things, including to be elevated into the evidence, we've got to use an experimental design, which means a random assignment of subjects to an intervention or a not receiving an intervention. And it's sometimes unethical not to give people an intervention when you know that it would be likely to help. Sometimes getting into the evidence base with fidelity is more heavily funded than it is in practice. And so it's hard to kind of keep that going in an uncontrolled environment without random assignment and without the funding. So that's a piece of it. Another piece is that there's often a lag by the time something goes through that process of becoming evidence-based and is submitted in peer-reviewed journals and meets the highest standards, it's often been several years. And so although building our practice off of evidence is critical and essential, waiting until something is admitted into the evidence base as an EBP, an evidence-based practice, can often mean that we already know more than we did when we did that initial work. And so it can become a bit of a lag in between the practice and what we currently know. And it makes it hard to innovate because many innovations are frugal innovations. They're moving on small budgets and moving quickly and don't have the resource to be able to do experimental design work and to submit into the evidence. And so it can be the use of only evidence-based practices can really unfortunately not include promising practices or other pieces of information that we might want to use. And so those are some of the challenges, and it's one of the reasons why we don't have a large number of evidence-based practices in our field. We borrow from other fields and we are using things that were really intended for early learning or education or other things that aren't meant to prevent abuse and neglect. And so that's another issue with using evidence-based practices. So I don't want to say that we shouldn't do things that don't have evidence, right? I think evidence is incredibly important, and we should build our practices and interventions off of the best of what we know so far. Sometimes that's evidence-based practices, sometimes that's well-evaluated other other pieces of work. Sometimes it's borrowing from other fields, but the key is for me that we use evidence-informed practices, and that means even our own practices are constantly gathering evidence. So as we try things, as we implement new programs, we are constantly measuring, evaluating, and have the feedback loop to go back and change things, to know, are they working? If so, why? If not, how do we stop them early and make adjustments? And so having community and lived experience input into the design of those measures, what's really important, and regularly monitoring and adjusting after we build things off of the current evidence that we have and promising practices is where I think we should be at this point.
Thank you. I really appreciate that. I will tell you, my children are sick of the idea of feedback loops because we do them for everything, right? Well, let's have a feedback loop about that problem. But if you don't have that everywhere, it is hard to really figure out what's working and kind of make these programs as we go. Thank you so much. Sheriff Dean, I wanted to hear from you too a little bit about evidence-based programs and practices and maybe challenges and benefits of what happened when you guys were starting to implement programs in DC.
Thank you. I think listening to Amelia's points, I think they're very salient and very on point. I think how we try to navigate and combat some of these systems issues as it pertains to evidence-based work and practices is that we really have put a lot of energy, a lot of time, a lot of effort into our quality control improvement process in terms of really making sure that there's a lot of continuous monitoring of the work that is being done by our partners in the systems that we're using, the data that we're collecting, how we are interpreting the data that we are seeing in our systems. So the continuous quality improvement systems that we have implemented with our data collection, the trainings that we offer, helping to build the capacity of our system, of our partners, of organizations that we work with, and also doing a lot of TA, a lot of support, a lot of, as you just stated, feedback loop, really engaging with our providers in the network. Like I said, we have our director. One of the things that we do often at Child and Family Services Agency is we have quarterly meetings. So we bring in everybody that's in the network, that's in the system, and we really talk about successes. We talk about glows and grows, right? You know, what has worked, what has not worked. What are some takeaways? What is the data telling us? How can we use some of this information to forecast and to plan ahead? Do we need to kind of, slow some of our work down a little bit and really refine and enhance and improve some of the things that we intended to do, but then we're not really seeing the results? And I also think we are very very comprehensive in our work because a lot of what we do is we have interactions with all of our systems, with our information systems. We have a lot of business process meetings, as Marina mentioned earlier, so that when we get information from the field, from the community, from the front line, we relay that back to our IT people and say, how can we refine this, or how can we enhance this, or we missed something when we first rolled this out. So do we have room to kind of go back and add this feature, because this can really enhance and give us more data or give us more of a better context as to what's happening. So I think that level of TA, technical assistance, that we steadily try to provide internally and externally, and also think making sure that there's a level of oversight and monitoring to making sure that even though we might not be able to reach the full evidence-based goal that we're reaching for, there's still fidelity in the work that's happening. There's still efficacy in the work that's happening. And we are seeing improvement and better outcomes for those who are getting these supports, who are getting these services. And our communities and the families are thriving and doing much better with the help of these systems that have come together to kind of address these gaps and these barriers that we see in our families that we work with.
Thank you so much, Sheriff Dean. I know, Marina, you had a follow-up comment?
Yeah, I just wanted to, and this is part of my admiration of practitioners, really, from coming from the IT side. We, when we were going through our services to, go live on October 1st with Family First, motivational interviewing was one of the things that our director said that is fundamental to any type of case management and support. And when people said, well, but it's not evidence-based in this field, it is on substance abuse prevention, but not in this field. And ACF is not going to approve it. It's not why we do that. And she insisted that no, this is fundamental. The entire agency became certified. We put special training on it, and we included it in our technology. We did a bunch of different things to make sure that people are led into that process. And then about, I guess it was a week ago, that we got approval for motivational interviewing as one of the prevention services. So I think having practitioners come up with what they believe fundamentally, the rest comes in, and that's kind of in support of what Amelia was saying, that we people have experiences and know what works.
Thank you so much. That was the perfect closing comment. I want to thank the panelists for such an incredibly vibrant discussion. This is always my favorite part, hearing how we cross-collaborate and attain greater strengths for each of our programs, trying to find the silver linings, and hopefully always using motivational interviewing. Participants, thank you so much for joining this session. We look forward to seeing you in our next session. Have a great day.
Child Welfare Virtual Expo logo. Text appears on screen. This video was developed for the Child Welfare Virtual Expo by the Capacity Building Center for States and is sponsored by the Children's Bureau. Its content does not necessarily reflect the views and policies of the Children's Bureau.